The chemistry of painkillers. Painkillers are drugs that disrupt the nervous system's transmission of pain signals. They work by blocking the production or interrupting the transmission of prostaglandins, the chemical that causes pain and inflammation in an area of tissue damage. Some painkillers even stimulate portions of the brain that are associated with pleasure, altering the way that pain is perceived. Common painkillers that we will discuss are ibuprofen, acetaminophen, oxycodone, and morphine.
Ibuprofen is a first drug. It's an NSAID drug. Symptoms that this drug is used to treat include headaches, dental pain, cramps, muscle aches, arthritis, fevers, and minor aches and pains due to the common cold. The most common brand names for ibuprofen include Advil and Motrin, as well as Brufen and Neoprofen. Early in the 1960s, researchers at Boots Laboratory identified the carboxylic acid as the agent that gave aspirin its anti-inflammatory property. They then investigated other carboxylic acids and discovered one even stronger than aspirin, compounds they had synthesized from phenylalkylanomic acids, eventually leading to ibuprofen. The chemical formula is C13H18O2. The IUPAC name is 2,4,2-methylpropyl phenylpropanoic acid. It contains two propyl groups, a phenyl ring, and a carboxylic acid. Ibuprofen works by blocking and reducing hormones that cause inflammation and pain in the body. They block the production of prostaglandins, which are hormone-like substances that the body releases in response to illness and injury. They are formed from arachidonic acid, a polyunsaturated fatty acid with 20 carbon atoms. When tissues are injured, this acid is converted to prostaglandins, which produce inflammation, pain, or fever. Ibuprofen is widely used to relieve symptoms of pain, fever, and inflammation. A study published in December of 2014 claims that regular doses of ibuprofen may lead to a longer, healthier life. In this study, researchers treated baker's yeast in flies with ibuprofen and saw that the treatment added about 15% more to the species' lives. However, ibuprofen can also increase your risk of a heart attack or stroke. It can cause stomach or intestinal bleeding, which can be fatal and occurs especially in older adults. Common ibuprofen side effects may include upset stomach, mild heartburn, vomiting, bloating, gas, constipation, dizziness, headache, or nervousness.
Another common pain reliever is acetaminophen. Acetaminophen is an over-the-counter pain reliever and fever reducer. It is used to treat many common conditions including headaches, muscle aches, arthritis, colds, and fevers. Acetaminophen is sold under a number of brand names, but the most popular include Tylenol and Excedrin. As one of the most commonly used drugs in the world, it is manufactured in large quantities. The starting material is phenol, which is nitrated to give a mixture of ortho and para-nitrotoluene. This is then distilled, reducing to produce a p-amino group. It is then acetylated to give paracetamol. The chemical name is 4-hydroxyacetanilide. It is important to note that the structure of acetaminophen includes a benzene ring, a hydroxyl group, and an amide group. Acetaminophen, like many other pain relievers, works by inhibiting the synthesis of prostaglandins upon injury or illness. It reduces the pain by blocking out these signals that the prostaglandins produce. Acetaminophen inhibits prostaglandin synthesis more specifically in the cells of the nervous system as opposed to ibuprofen, and therefore does not possess the same anti-inflammatory properties. It does, however, have the benefit of resistance against platelet aggregation and blood clotting. Furthermore, while acetaminophen is safer for children and is easier on your stomach, it can also be harmful to the liver if it is taken in a dose larger than recommended.
Oxycodone is a semi-synthetic opioid alkaloid with analgesic, meaning pain-relieving activity, that is similar to morphine. Its chemical composition is C18H21NO4, containing a ketone group, ether group, hydroxyl groups, and benzene ring. Oxycodone binds to mu, kappa, and delta receptors in the central nervous system, inhibiting adenylyl cyclase and hyperpolarization of neurons, as well as decreasing excitability of neurons. This occurs when oxycodone binds to the opiate receptors because it results in the exchange of guanosine triphosphate, GTP, for guanosine diphosphate, GDP, on the G protein complex, inhibiting the enzyme adenylate cyclase. When this enzyme is not able to bind to the receptor, the intracellular messenger is not able to properly communicate because of the interruption to the release of chemicals that assist or serve as neurotransmitters, such as phosphorus, gamma-aminobutyric acid, dopamine, acetylcholine, and noradrenaline, is inhibited. To clarify, oxycodone alters the perception of pain at the spinal cord and higher levels in the central nervous system. It does not alter the threshold or responsiveness of nerve endings to stimuli or the conduction of impulses along the peripheral nerve. Potential risks of oxycodone include the side effects it can cause on the body, including constipation, drowsiness, and nausea. It is also a prescription drug that is one of the most likely to be abused and has a big potential for overdose by its user.
Morphine is a prescribed pain reliever. It is prescribed for moderate to severe pain. It can be taken for short-term acute pain or an ongoing basis for chronic pain. It can be administered intravenously, injected, or by mouth. It occurs naturally in opium, which comes from the stem of a poppy seed. The chemical formula is C17H19NO3. It is composed of an aromatic ring and a quaternary carbon atom linked to a tertiary amine group by two other carbon atoms. The functional groups of morphine include a phenol, alkene, ether, alcohol, aromatic ring, amine, and a cycloalkane. Morphine is a central nervous system depressant. As an opioid, it works by activating and binding to opioid receptors in the body. These receptors are responsible for providing analgesia to pain relief. It mimics the effects of the natural opioids in the body. It can also decrease the transmission of pain impulses in the body by interrupting the pain messages in the spinal cord and interfering with messages coming from the central nervous system. Mostly, morphine is the base for making other opioids such as heroin and oxycodone. Common side effects of morphine include drowsiness, dizziness, and nausea. Due to its habitual forming characteristics, the misuse of morphine can cause addiction, overdose, or death. Morphine is usually used in a hospice setting to relieve severe pain before and after surgery. It also is used to improve end-of-life care and pain management of terminal cancer pain.